In my last video, I talked about heartburn after sleeve gastrectomy. Today, I'm going to cover the other pitfall we see after this procedure, which is weight regain. In the past, I've been a little bit reluctant to really embrace the sleeve gastrectomy, where other surgeons 5 years ago, 10 years ago, were doing 80-90% of their practice as sleeve gastrectomies because of the simplicity and the low complication rate. I was really a little slower to embrace it because I saw so much weight regain, even in patients who are eating really well. And to have that where you lose all of this weight, have this moment of finally feeling like you've solved this weight problem and then starting to see it come back, that was so emotionally crippling with my patients. And so I wasn't so fast to really embrace it. But now we have GLP1 medications, and these things are awesome when it comes to treating weight regain, or we're putting patients who've recently had a sleeve within the last few months or longer and getting them on the meds, and we're seeing tremendous weight loss. When we combine a sleeve with the medications, we're seeing more weight loss than we would see if we did a gastric bypass. And so when you combine the meds, they're great. If you've regained weight after a sleeve, it's a great tool as well. So now we have this treatment for weight regain, but I think it's really important if you've had a sleeve in the past or you're planning on having a sleeve in the future to recognize that GLP-1 medications are probably going to be part of your long-term weight control plan.